but we want to point our attention to Florida because cases there, they rose yesterday at a level of 4.9%. The previous 7-day average was 4.7%. To help us understand what this means and how they will be going forward, we invite into the program Dr. Cindy Prins, University of Florida, Associate Professor of Epidemiology. You've been with us before. It seems much more dire now. Are there any signs of hope out there for Florida?
Well, I think that there can be some signs of hope. I think that we've taken some steps to try to mitigate a little bit of this. Mask mandates in certain areas, although not across the state. So I want to see that step taken. And then another step was to stop serving in bars, to shut down some of the transmission there. And of course, that all takes time. So we need to give it a little time to see what kind of effect that has. But it's still a concern, though.
Dr. Prins, I want to ask, I guess when it comes to these kinds of areas, is it really the fact that they had opened indoor dining, and is that why we've seen such drastic increases in cases, or is it just a mix of indoor dining and people kind of congregating more often? Because we're seeing in New York and New Jersey, they've kind of completely shut out indoor dining for the foreseeable future.
Yeah, so I mean, we know that indoor dining could be a potential risk because people aren't going to be masking in that area, although when you think about a restaurant, you hopefully think about people kind of staying within their own group. A couple of the other risk factors that happen, though, are you may be meeting people from outside your own household. So how big is your group? How many people are coming in that you haven't had contact with? And all of those things need to be weighed, as well as how big is the restaurant? If you're at 50% capacity, that may be very different for one restaurant versus another. So I think indoor dining is something we still need to look at, and we may need to be a little bit more nuanced in how we're approaching control in some places like that.
Hey, Dr. Prins, Rick Newman here. It's a little mystifying watching from afar as these case counts, hospitalizations go up. It looks like the death rates are rising as well. And yet there still is this reluctance by some government officials to really impose strict lockdowns, which makes me wonder, could this just go on indefinitely, that we just see the case counts rising or staying sort of stabilizing at a high level, or will this inevitably have to come down at some point?
Well, the problem is that if this just keeps going on, what we see are deaths rising as well. And, the problem is also that we haven't really hit a point where we have that high a percentage of the population infected. And so if we were to allow this to keep going, we'd really be looking at a lot of morbidity and mortality associated with COVID-19 in the state. And so, yes, theoretically, if everyone just keeps doing what they're doing, you have the potential for this to continue on for a while. But, we can't let that happen. We need to put something in place. I'm not necessarily in favor of a full-on lockdown, but I think that we do need to look at activities and places, assess the risk, and figure out how can we reduce that risk for people.
Well, do you feel like you can see a point where the curve begins to turn down again?
I think so. I think that we could see that if we can really get people to start to pay attention to the fact that you have to wear a mask. You just have to. That's how we're preventing this. You have to reduce the amount of time that you're spending with other people indoors if they're not part of your household. And you also have to reduce that distance that you are from people. So you've got to maintain that social distancing. And those are all together things that you need to do. And that means you have to change some of your activities, especially right now.
Dr. Prins, when we hear statistics that hospital bed capacity in ICUs in parts of Florida are approaching 90%, does that include the beds that are set aside for people who might have non-COVID-19 related issues? And what happens to those people? Heart attacks still take place, strokes still take place, right?
That's right. And there is some concern. The CDC put out a report a few weeks ago showing that there was a reduction in ED visits for people with some of those severe conditions like stroke and heart attack. And the concern there is that people are afraid to go to the hospital, even if they may have an emergent condition. And, those bed capacities, there's excess bed capacity that hospitals can put forward. And I don't think what we are reporting right now includes that excess capacity. And there's also excess equipment capacity for things like ventilators. But, we have other things that we run short on. We run short on personal protective equipment. that is so critical for preventing our healthcare workers from getting infected, we also can run short on healthcare workers. So we worry about them not being able to keep up with this level of cases, and especially when you have hotspots in multiple places in the United States.
Doctor, I kind of want to ask you a question on the idea or the kind of growing rhetoric around people thinking that this is now something that's easily contained or easily treated, that we've had enough exposure now to it in hospitals and with doctors that they're able to treat people more efficiently. And so we're not going to see the mortality rates that we had originally seen. You think that's kind of a reason to allow people to continue to congregate, to kind of flout mask rules and I guess step away from the idea of a new lockdown?
So while it's true that I think that there's better medical management now, and I think also there's more widespread testing, so we're seeing potentially earlier detection of positive cases, people may be more aware of when to seek health care before they get severely ill. But I don't think that any of that and any potential decrease in mortality related to that is a reason for people to just decide that it's okay to congregate. I really want to emphasize that what we're also learning more about now is that when you get ill, even when you recover, you may have other issues that go on longer term. So now we're seeing neurological issues, we're seeing other potential issues related to cardiac problems that people may be dealing with for a while. So, this is not a minor illness.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.